Thank you for inviting me. My name's Giles Davies and I'm a consultant oncoplastic breast surgeon, and I'm the Director of Breast Surgery at the Cromwell Hospital and a member of the Medical Advisory Board. The breast service, when I started around 4 years ago, was quite a traditional one, and by that I mean we had groups of individual consultants who worked quite differently in both the processes, methods and the way they saw patients, and also quite a fragmented service where imaging was often disconnected from clinical consultations. When I started, I assumed, a little bit naively, that the BUPA clinics had a working relationship with the hospital and that there must be rapid access cancer diagnostic pathways. And I was surprised when that wasn't the case, and that some of the patients referred to me were coming clutching a CD-ROM they'd waited for, having seen an abnormal report in their hands some 2 weeks before sometimes. And it built in a lot of delay and actually started the patient's journey with quite a poor experience. Fast forward, and what we've done over the last 4 years is really transform that into a patient-centred pathway, delivering patient-relevant outcomes and measurement, which has created a much more bespoke, responsive and accessible one-stop pathway. So, for example, when a patient comes to see me in clinic, every single appointment is one stop, and by that I mean they have access to all the imaging that they need, including guided biopsy. And that's really important. You know that whatever you find, you're going to be able to deal with it there and then, and the patient is leaving the room with a complete answer at every time. By automating certain parts of that pathway, it takes the variability out of it, and we've measured and looked at our results, and it's led to a much, much better patient experience. Value-based healthcare is measuring quality in relation to outcomes that matter to patients and their cost. And of course, to do that, you need to measure. And I think when I went on the Harvard Business School seminar, it really opened my eyes to a whole new paradigm and a whole new way of measurement and recording data that has massive, massive impact on patient care. The first thing we did was look at the patient pathway, if you like, the patient journey, and look at the steps that the patient takes, the sort of process of that journey, and look at where decisions are made, so-called decision nodes. And we then looked at what data are we recording now and how could we record it. It's actually quite difficult to develop a data-driven pathway. And of course, in a cancer speciality, the obvious place to start is within the multidisciplinary team meeting. That's the hub of data collection. And of course, like with any data, the data is only useful if you record it, and you record it in a way that you can analyze it. So we started with those two things, the patient pathway and data recording and data points. We then moved on to coding episodes, and we then moved on to looking at the rapid pathway from the Basinghall Clinic into screening and breast screening, and finally we're now into really looking at our patient-reported outcome measures, PROMs, and not only delivering them but actually using them as a tool, and in fact probably the only true measure of the quality of the care that we give our breast cancer patients. The Basinghall Clinic has provided a unique opportunity as a sort of satellite unit to create an integrated practice unit, and because we've co-located primary and secondary care specialities alongside the patient. And when I was developing the breast service, I wanted to make sure that low risk, so-called low acuity patients, young patients with hormone problems, patients going through the menopause, were seen in an environment where they had access to primary care physicians with an interest in the menopause, and if they were referred because they were unlikely to have a cancer diagnosis but have other problems, that they were referred in an environment where the sort of cross-pollination of expertise could be built around them, so putting the right people in the right place at the right time for that patient's specific condition. And I think that concept of integrated practice units is about defining the patient condition, really owning the whole care cycle, so understanding that the care cycle of that condition, and then embedding people around the patient, whether that's specialists coming to the satellite unit rather than the patient travelling off to see a variety of different specialists. And in fact, we've really, it's really taken off here because we routinely refer to the menopause product within BUPA, and patients really value that because of course they may have cysts or be recalled with an abdominal mammogram and not have cancer, but it doesn't mean we forget about them as whole patients. So it's quite a privilege to be able to know that you've got the backup and extended resource of other clinicians to help really provide a comprehensive pathway for that, for women's health at the Basinghall Clinic. It's actually quite difficult to develop a system to capture and use data well in healthcare. And actually, information technology systems in healthcare are often quite complicated, and often we use several systems, none of which does the job completely well. So the first thing was the process of capturing data in an automated and continuous way. And we worked very hard, and we're still working very hard at trying to capture those key data points reliably, and whether that's cancer tracking, whether that's diagnostic coding, and whether that's patient-reported outcome measures. The second real difficulty is bringing people with you on the journey that they perceive will be of benefit to their patients. Some people, for some reason, feel that value-based healthcare or PROMS is more a sort of soft measure of success rather than the hard process metrics that we're used to. And we're very good at the Cromwell, like a lot of organisations, at measuring how good we are in terms of length of stay, infection rates, VTE prophylaxis compliance, but we're not good at measuring things that actually really are relevant and valued by patients. And so it's a whole cultural shift, and some people think that PROMS are sort of soft experience surveys rather than what they really are, which is the true measure of the quality of the care that you're giving to patients. So those two things, I think, have been the main challenges and barriers and remain ongoing in some areas. So the impact on the patient experience for me has been nothing short of transformational. We didn't know about whether we were good or what we were doing when I first started. We couldn't even reliably tell how many cancers we were treating at any one point in time. And now we really understand the patient journey, and things like our Net Promoter Score or the patient feedback that we get through websites like I Want Great Care has been literally through the roof. Our Net Promoter Score at Basinghall Clinic was 100. And why? Because we're putting the patient at the heart of the journey. And so we know what we're doing, and B, we know we're doing well. So when we analyse our FLAP data and find we've got a 0% major complication rate, obviously that's good, but we didn't know that we were good. So of course it's just of benefit to us as it is to patients, because we've got evidence of the quality of our outcomes, and evidence that's in a form that's valued by patients. And so patients understand what quality looks like because we're giving them the information that's relevant to them. I think as a patient, if I'm looking up on websites about the average length of stay of an operation or the infection rate, that doesn't really resonate with me, apart from perhaps looking for a consultant who has significant experience or is recommended by somebody else. But I have very few ways of understanding what quality looks like and how that relates to me and my condition and my choice to utilise a certain healthcare provider. So BUPA has an enormous opportunity to be the first true patient-driven, patient-reported outcome, measurement-driven, patient-centric organisation, publishing outcomes that are relevant to patients. Because who are you going to choose? You're going to choose a BUPA organisation because we produce and publish and share outcomes that are relevant to you as a patient.